Joint replacement has evolved greatly in the last 10 years. With the amount of technology that's available to adult reconstructive orthopedics, and hip and knee replacements has progressed greatly, from navigated components, navigated instruments, robotic-assisted surgery for both hip and knee replacements, the aids that we have in the operating room to assist in balancing and position the components has improved greatly, which we have all of those available to us at Henry Ford. I think a perfect joint replacement, in particular knee replacement, is a well-aligned and a well-balanced knee. And the instruments that we have in the operating room to put in the implants in perfect position with perfect balance is second to none anywhere in the country.